Or if we have conversations. And of course, there are many specific skills for conversations, but here's just one way of breaking out the skill of starting a conversation. Choose the right time and place, and so here you kind of get into talking about, well, what is the right time and place, and choosing a person if they're not occupied in doing something, a place where it would be appropriate to initiate a conversation. Introduce yourself or greet the person you want to talk to. Make small talk, and of course that's kind of a big skill in its own right, and so you may identify different topics in terms of small talk. What are appropriate topics? It could be something related to where you are. If you're at a museum, it could be related to a painting that you're seeing, or if you're in a special group with a particular interest in nature conservancy, it could have to do with a topic related to that. And then try to figure out if the other person's paying attention and want to talk. So these are just examples of different ways of taking skills and breaking them down into steps. Now, social skills training can be taught either in groups or individually, or you can even use a combination of the two. Most commonly, people have used social skills training groups because there's a number of natural advantages to having groups. One advantage is that when you have people working on a particular skill, they can benefit from seeing each other practice the skill and giving positive feedback. The giving positive feedback to people and suggestions for how to correct or how to improve their performance can make people feel that they can contribute to other people. It gives them ideas in terms of how to improve their own performance. And you get a kind of a group spirit in terms of working together. One of the important things about doing skills training groups is that the focus is really on trying to improve people's skills. And you try to help people identify interpersonal goals that they want to work towards that the skills are related to, such as having friends, making a friend, improving relationships with family members, developing leisure activities, more independent living, and so on and so forth. And then to develop a link, establish a connection between the particular skills, the conversational skills, or the other skills that you're helping the person learn, and the ability for them to achieve their personal goals. Another thing that needs to be built into social skills training programs has to do with the programming of generalization. I talked about this a little bit earlier this morning, but skills that are taught in a particular situation often don't just spontaneously generalize or transfer to other situations. You need to program that transfer so that the people are able to use the skills to actually express positive feelings or negative feelings or to start conversations. And there's a number of different ways of programming the generalization of skills. One way is giving homework assignments for people to practice the skills on their own. Another way is to do community trips where people will actually go into particular community settings and practice particular skills. Yet another way is to involve indigenous supporters, people who see the person on a regular basis and may be in a position to help the person practice and use the skills in appropriate situations where the person might not remember on their own. All of these are frequently used different methods. The more you can use, the better, because the real goal is to help people practice and improve their interpersonal skills in real-world settings. And yet, the practice of those skills in groups or individually is a good way for them to get some experience and familiarity with the skills. So it's useful to have both a session in which people are learning social skills, but then opportunities for them to practice them in real-world settings. Now, skills training groups vary in terms of their length and their intensity. Often skills training groups are done more than once a week, such as twice a week. Sometimes they're done once a week. We have done a skills training program with older individuals with severe mental illness, older than age 50. We've had it very difficult for them to get into the clinic or the senior citizen center where we were doing the groups more than once a week. So we developed a format where we would have a morning session, an informal lunch, there'd be socialization, and then there would be an afternoon session. So we got our 2 sessions in per week, but they were both on the same day. Typically, if you're running it in terms of groups, you want to have numbers somewhere between 5 and 8. It's better not to go over 8 because it's really hard for everybody to get practice using the skills in a particular group once you go over the number 8. And additional factors, if you're working with people who have a lot of impairment, either cognitive impairment or flagrant psychotic symptoms, those people can participate and very much benefit from skills training groups. But you need to lower the number of people in the group so you can give people more attention and that you don't have to just count on them paying attention while other people are practicing. It's useful to have reinforcement for participating in the group, such as snacks and refreshments. They can be held afterwards. Primary reinforcements are always a good way to stimulate learning experiences. And it's important for staff members to get staff support for doing skills training. It takes time to run a session, to plan for it, and the like. And so if this is seen as something that's above and beyond the call of duty, even the best-intentioned clinician is not going to continue performing skills training groups. It needs to be built into both expectations, and there needs to be support for doing that. In terms of leader qualifications, I think enthusiasm is very important. You want to be able to generate a certain level of interest and enthusiasm and engagement of other people in the group. You want leaders to be able to develop or to already have a behavioral orientation, meaning being able to focus on particular behaviors, give feedback about behaviors, rather than trying to delve into creating insights. A lot of us out there, I know Eric and I were talking about this over lunch, believe that insight into one's current situation or difficulties really best develops as people actually learn how to change their behavior. So rather than trying to create insight with the notion that it's going to lead to behavior change, in social skills training, with a lot of encouragement and support, we help people change their behavior, and often insight follows that. The ability to take a shaping approach. One of the things about skills training is that change does occur very gradually, and I'm going to be getting back to that later, but it does occur, and as I'll also be getting to, at this point, social skills training is the best methodology we have for improving people's functioning. So what you need to be able to do is to take a shaping approach, shaping referring to reinforcing successive approximations to a behavior. In other words, you see a very small change and you draw a lot of attention to that small change, you get lots of feedback, and then you work on the next change. Being able to see those changes and reinforce them, and reinforce the effort underlying them, is critical to keeping people engaged and involved and supported in learning social skills. You want people to be knowledgeable about psychiatric illness, such as schizophrenia, the nature of negative symptoms, and it's desirable for the leaders themselves to have a modicum of social skills. I'm going to keep kind of moving through, but to talk about basic skills that are, or basic teaching methods that are incorporated in skills training, modeling or demonstrating skills, very commonly used, not just the first time a skill is introduced, but to help people learn particular nuances of skills. Reinforcement, in particular positive reinforcement for things that have been done well and for efforts. So that's why the reinforcement is often very specific in terms of a particular component of a skill. And this is not reinforcement just provided by the leader, but elicited, if you're doing it in a group, from other group members to the person. Shaping, which I already described, meaning you're reinforcing these small approximations to a goal. And then generalization, in other words, preparing the person and helping the person practice and use the skill in situations other than within the social skills training group.